Hello, my name is Kristen Harper. I'm the Policy Director at Arkansas Advocates for Children and Families, and I've been asked to talk to you today about some highs and lows from the legislative session as it pertains to child welfare. It was relatively quiet on the child welfare front this go around in 2025, but one high was Act 139, which increases permanency options for older youth in foster care. So typically, before you adopt a child in Arkansas, there's a residency requirement that says the child has to live in that prospective adoptive home for at least 6 months before the adoption is finalized. And in the past, before this law, we had some older teens in foster care who had found their forever family, but at the time were living elsewhere, specifically in like a job training program on site. And so as a result, that adoption had to be delayed or in some cases never happen. Now, with Act 139, the Division Director for Children and Family Services can sign a waiver to allow youth 16 and older to go ahead and finalize that adoption if the reason they're not living in that adoptive home is because they're at a technical or vocational program. So this is going to impact a very small number of youth, but for those youth who it does impact, it's going to make a big difference. Moving on to an example of a low for child welfare in the session was Act 636. This act allows the number of psychiatric residential treatment facility, often referred to as PRTF, allows the number of PRTF beds in Arkansas to increase to a total of 900. Which almost doubles the number of PRTF beds in our state. If you're not familiar with the PRTF, these are extremely restrictive mental and behavioral health facilities for young adults up to the age of 21. Our concern here is, in the past, there's been very little data to demonstrate that PRTFs have produced positive outcomes for kids. And there have also been several issues in the past with ongoing safety concerns, including several reports to the Child Abuse Hotline for children who are staying in these PRTFs. Typically, a PRTF stay, it ranges from about 3 to 6 months, but unfortunately, sometimes those stays end up being much longer. The other big issue with this law is it took out existing quality of care standards for PRTFs. Now, this new law does say that the Department of Human Services has to make new rules to address quality of care standards as well as health and safety standards for the residents, but this law went into effect before the rules were made. In fact, those rules are still under development. What we argued is we should have implemented these new rules, see if we had improvements, and then at that time it would have made more sense to expand the number of PRTF beds in our state. We also had a couple of missed opportunities in child welfare. One was Senate Bill 585. If this bill had passed, it would have required employers who have 10 employees or more to provide pay stubs to employees who are under the age of 18. Unfortunately, in Arkansas, employers are not currently required to provide pay stubs, but this bill would have ensured that one of the most vulnerable components of our workforce, meaning kids under 18, would have received those. We are proponents of teenagers having appropriate jobs. It teaches confidence, time management, financial literacy skills, but we want to make sure that kids are working in safe environments, and that means more than just physical safety. So we were disappointed that this bill did not pass. And finally, HB 1996 was another missed opportunity. This bill would have required schools to display a poster that outlines in a child-friendly way what existing labor laws are as it pertains to teenagers working. You may remember 2 years ago in the 2023 session, there were changes in terms of no longer requiring employment certificates for kids who under the age of 16 who are working. And so this bill would have required just to provide education and information to the students in the school, as well as to teachers and parents who are walking in the school, to know just basics about, how often a child under 16 can work, hours, safety conditions, things like that. The good news on this is there was what's called an interim study proposal filed to continue to look at this issue, so it may come back around in 2027 to provide this important information to kids and families.